is also available now for those of you that would like to use that function. It's a little button at the bottom of your screen. Just click on that and you should be able to see the closed caption. All right, so let's go ahead and get started. Welcome everyone to the 5th session on our final day of the 2020 State of Enrollment Virtual Conference. I'm Sonia Lara, Outreach Enrollment Director for TAC, and I'll be facilitating this session this morning. A few housekeeping items you're sure to be familiar with by now. The session is being recorded and we will share the recording via email. It's also going to be available along with the slides, hopefully early next week, if not sooner, on the conference website. I know that we've already posted Monday sessions up there. The slides and the recording are already on the conference website. So if you missed any of the Monday sessions, they're available now for viewing. Please use the Q&A box to ask your questions. If you want to ask a question live, raise your hand and one of our Zoom techs will unmute you so you can ask your question live. But if we don't get to your questions today, we'll follow up with you afterwards. Please use the chat box to interact with one another. You guys have been doing an awesome job through the whole, all the other sessions, and really like to see everyone participating and interacting. Since we can't be in person this year, this is a great way to do that. But just please, as a reminder, don't put your questions in the chat box. There's a lot of you that are interacting, which is great, but we don't want your questions to get lost in that chat box. And so if you please, again, use the Q&A for your questions. That would be very, very helpful for us to make sure we don't miss any of your questions. Also, if you have any technical issues, please put that in the chat function and we'll help you troubleshoot your issues. So I'm going to go ahead and ask for our first poll to be put up. This being the third day, you guys are probably now familiar again with the drill. We would like to put up our first survey poll just to help us gauge the effectiveness of this session. And so that will really help us make sure that we are doing what we can to make these good learning experiences for everyone, as well as improving for future sessions. So we're going to give you all about 1.5 minutes for that. And please answer the best to your ability. Thank you. We're going to give it a few more seconds here. Please answer those questions. Again, this really helps us when we plan and improve these sessions for you. So we really appreciate your feedback. Almost there, inching up, inching up. Come on, people. All right, well, we've reached our, our goal. We've got 70%, so sharing the results here. You don't have to share these. We're gonna go and get rolling here. All right, so this session is titled Targeted Marketing and School Outreach During the Pandemic. We're gonna focus on targeted marketing messages for prospective new marketplace eligibles who may be eligible for subsidies as well. And then we're going to follow that with a discussion on school outreach in the time of social distancing. So I'm going to briefly introduce our speakers, but you can find their full bios on the conference website. First, we will hear from Lisa Goodgame, who is the owner principal at Lisa Goodgame Consulting. She primarily works with nonprofit and mission-driven organizations, and since 2016 has been a valued member of many state coalitions and groups that strive to expand healthcare coverage. Excuse me. Our next three speakers are from the Children's Defense Fund of Texas, the Rio Grande Valley office. First, we're going to hear from Gracie Camerena, who is the Child Health Outreach Program Director. Gracie has 18 years of public health and social services experience, and she also works with families, schools, and community partners to connect uninsured children with affordable healthcare coverage. Next, we'll hear from Mary Carreon. She is a community health outreach associate who has over 20 years of experience in public health. And she works closely with the leadership of different entities, including schools, local city government, health systems, and faith-based organizations. And then we'll hear from Tina Guel. She is also a community health outreach associate with 20 years of experience, including 18 years as a community health worker and 5 years as a Texas certified community health worker instructor. So she strives daily to reach families and connect them to healthcare options. So I want to thank all of our panel for being here to share your expertise. And I'm going to go ahead and hand it over now to Lisa to begin her presentation.
Hi, everyone. Thanks so much for being here today. Melissa, I just want to clarify, I can share my screen from my window?
Yes, you should be able to share as a panelist.
Okay, great. So today we are going to talk about, hold on, let me get the share up. Okay, hopefully folks can see that. I titled this Open Enrollment Media Training, but media training isn't exactly what we're doing today, although we will talk about that toward the end. What we're really talking about today is messaging about the Affordable Care Act, about open enrollment, particularly to people who have not been in the marketplace in the past, and people who haven't been in the marketplace because they have had employer-sponsored insurance. And so buying insurance in the individual market has not been an experience that they have had, but they are experienced with health insurance. This is a little bit of a different audience than I think we typically think about talking to, because now that the Affordable Care Act or open enrollment is in its 8th season, we are typically talking to people who have been in the marketplace for some period of time and are experienced with what that process is and experienced with what individual health insurance is, right? With the kinds of plans that we help people choose in the marketplace. Versus people who, and also people who have been uninsured for some length of time and don't have much experience with health insurance, and coming into the marketplace may be the first time in a long time that they have been able to buy insurance and start to understand how to utilize it. I think this year we are going to see a different or, sort of larger share of our potential client base to be people who unfortunately have lost their jobs due to the pandemic, and in the process have also lost their health insurance. We are going to talk today about a specific subset of folks and that is people who lost their health insurance and may have chosen COBRA as their option, as their health insurance option to carry on after they've lost their health insurance. They're in a unique position. They are paying a lot of money for their health insurance plans. I don't know if anyone in this group has had to utilize COBRA in the past, but I had to utilize COBRA before the Affordable Care Act came into existence. And I personally, as a, healthy person with, at the time, minimal pre-existing conditions, alone was paying $1,000 a month for my individual plan. So I certainly understand the position that folks who have lost their job and are suddenly paying potentially exorbitant amounts to cover themselves and their families. I believe that the marketplace can be a very, very good alternative for them this year, especially if they are in a position to get financial help. So that's a little bit of context about what we are going to cover today. For folks who were in my session last year, we are going to try to do some of the interactive activity this time virtually, but just a caveat, I have not done this virtually before, so it could be wonderful and it could be a nightmare, but I appreciate you being here and being game for at least trying what we're gonna do. Unfortunately, I don't have any mini chocolates to hand out this time, but imagine that you're getting mini chocolates as we go through our session. So let us get started. Whoops, what's happening? Okay, there we go. So you'll have this presentation. This is just a little bit of information about me and how to get in touch with me if you have questions after the fact. I'm happy to connect with folks. And I have here for us to start with some introductions. Sonia introduced me, and I don't think I realized we were going to have quite so many people on the webinar today, but I would love to just know a little bit about who's here. So please share this information in the chat, and I will, sort of periodically skim through it. But I think it would also be great for folks who are in the session to know a little bit about everyone. It's possible you all did this on Tuesday, and I didn't know that, but I'm gonna pop into the chat for a minute here and just kind of see what folks are sharing. Okay, see we have Gonzalez, Texas represented, San Antonio, Austin, North Texas, Dallas, more San Antonio, Ellis County, El Paso, Northeast Texas, Pleasanton, Rio Grande Valley, Lubbock. Wow, we've got folks from all over, and I see also a lot of different kinds of organizations represented here. So this is great. Thanks so much for sharing this. It helps me have a little bit of context of who is here with us. Sorry, I've been skimming through and not announcing who's here. Crystal City, Port Arthur, Houston. There's been a lot of Houston. Great. Wichita Falls. Thank you everyone for sharing this. Learning how to build community in virtual spaces is, I think, a thing we're all learning how to do. Okay, so let's go ahead and get started with our material. The first thing I want to start with is the operating environment that we have this year. I like to do this as a bit of context and kind of help us get into the mindset of what we're dealing with. Especially since, you know, the first open enrollment season in the current administration, things have changed, right? Quite a bit every year. And open enrollment has, at least to me, felt like it's always going to be a little bit different. We don't know what the challenges are going to be. I think that would be true under any circumstances, but we've had some really, you know, big changes happen each year. And so I call this section, you know, kind of what we want to solve, identifying some of the challenges that we have and thinking about the creative ways that we might address them. So here is what I've identified as this year's current operating environment. Of course, first of all, we have the pandemic. We have much higher unemployment, and in some parts of the state, the unemployment rate has tripled. I was looking at unemployment rates in various areas of the state, and I know that folks in some places are really looking at a very different employment picture than they have had over the past few years. So health insurance losses as a result of that unemployment, and all of those things together, I believe are going to increase interest in the marketplace as an option, in part because we have seen that happen in other parts of the country, where the states have their own exchanges, and they opened SEPs during, they opened SEPs, you know, starting in April or May, and the interest in marketplace options was very, very strong. Excuse me for a second. So we have this potential new audience that needs education. On the one hand, I think they tend to be more educated about healthcare, health insurance and health insurance utilization, but they have never been in or have unlikely been in a position where they have had to buy an individual plan and frankly had choice of individual plans or choice of health insurance plans at all, because as we all know, typically employers offer very few choices, if any choices at all. We have, again, the impending Supreme Court case and the sort of general fear of loss of the Affordable Care Act. And this is a different, has a different flavor to it this year, because the arguments at the Supreme Court are going to happen on November 10th, just minutes after the election, at a point when we may not know the outcome of the election still. And, smack dab in the middle of the first 2 weeks of open enrollment. So I think this potentially will create a little bit of a different environment. It may not be something that the vast majority of our potential clients are thinking about, but it will be something that media is thinking about and maybe coming to our organizations for comment. Again, we have no federal funding for for marketing, advertising, and outreach, which is why our great session is happening today, to think about how we deal with that. We have short-term plans and other products that may draw consumers away from ACA plans. I know here in the Austin area, for sure, there are some startups that have really gained traction in the last year or so that are really not great choices for people, especially people who would be eligible for subsidies in the marketplace. We have an unclear rate situation. It looks like rates based on filings are likely to go up for most carriers, but we're not going to know that still for a little while. Last year, for example, we were able to say that the rate situation was generally stable. There weren't tremendous swings, but this year we have some carriers who have proposed double-digit rate increases. So that's something that we're going to have to, face much closer to open enrollment. This season could be very newsworthy because of the election and the court case. That's a double-edged sword. On the one hand, that's news that we don't necessarily want to or will not always be able to respond to, especially with media, because many of our organizations are not going to comment on the political situation. The flip side of that is when the ACA is in the news, especially as it was 2 seasons ago, it's kind of all news is good news, any news is good news situation, because some people just hear ACA over and over again, and it just raises the profile of the program and doesn't necessarily incur a negative association for folks. And then finally, the rates, the court case, and the election, I say may add to consumer confusion, will probably add to consumer confusion. So that is what I think the current operating environment is. Is there anything folks would like to add to that, that they're thinking about? I think we probably need to put hurricane season in here, since we're seeing so many more storms this year. Anything else folks think might be missing from this? Give it a second for folks to share some thoughts in chat.
Lisa, correct me if I'm wrong, but did you miss one of the bullet points between no federal funding and short-term plans? You said possible outreach to existing.
Oh yes, thank you. This is the emails and texts and phone calls, like automated calls that healthcare.gov, I say healthcare.gov, but I think you know what I mean, has made in the past to folks who, are already enrolled, encouraging people to, roll over their plans or what have you. That outreach did happen last year. And so I'm kind of going on the assumption that some version of that will happen again this year.
We've had a couple of comments in the chat box too. So
okay.
The public charge chilling effect.
Yes.
Fewer grantees and confusion with junk insurance solicitors.
Yeah.
So kind of related to some of your talking points there. So yeah.
Right. Yeah. The short-term plan situation. I think we would include, the junk insurance brokers in there. Public charge is not something that I included. I think I may have included some of it in the talking points, but because I figured there would probably be a session focused on that again this year. And so I didn't want to, necessarily spend the time to repeat content that you're probably getting from someone who is more of a subject matter expert in that area, but it's a really good point. Instability for consumers in their job situations. Yes, I think that's going to be a big challenge this year in terms of estimating income and, as Melissa says here, knowing whether they will or won't need insurance. One of the things that we kind of have the luxury of now, because there is not the individual mandate or the penalty, is that we are in a position to now be able to tell people that they can, if it's relevant, sign up and leave, at any time if their situation changes. We could say that in the past if people got a new job, all of a sudden got employer-sponsored insurance, but now people, they kind of have the luxury to try it and see without that risk or fear of the penalty. Obviously, we want people to be insured as much as they can be, but it is a little bit of a different angle that I think we were able to take. Okay, so if you think of some other, household budget uncertainty, yes, that gets us, kind of back to that question of how do we help people make their income estimates. And, again, I think we have that ability to let folks know that if they misestimate, is that a word? Their income, right? Because their situation changes, there's not necessarily going to be a penalty for that. Okay, so let's move on. I have a couple of interactive things for us to try, and then we'll get to some key messaging. I keep having trouble, advancing my slides. Okay, so these are the things that we are, kind of thinking about today. How do we educate recently unemployed and uninsured Texans about their options? How do we, and some of these are things, right, we think about every year. How do we push back on the negative narrative that the ACA is doomed, so why bother? In reality, that has not actually been as much of a challenge in the last couple of seasons as we thought it might be, right? Although there have been variations across the state, overall enrollment in Texas has been pretty stable. How do we tell a positive story about the benefits of the ACA and the financial protections that come with being insured? How do we frame why health insurance is so important right now because of COVID-19 without scaremongering? Right, we can think about talking in terms of protection, feeling secure that we know we have access to the health care that we need, versus a negative message there. How do we present marketplace plans as likely a more affordable choice than COBRA? And how do we talk about modifications to services and safety measures that we're taking this year? I would love if people would share in the chat some of the ways that your organizations might be handling in-person assistance this year. If you are continuing to plan to have like in the same physical space, in-person assistance, or if you're shifting to some online services or phone-based assistance, things like that. Would just love to hear what kinds of things folks are doing. Okay, so we're going to take a couple minutes now to do a brainstorm about just all of the negative messages you can think about ACA enrollment. I call this, you know, like a clearing the cobwebs kind of activity. This is a chance to just kind of get all the negative garbage out so that we can, you know, kind of clear that away and then start to focus on the positive messages. So we'll give you, you know, a couple minutes to think about that. And then I have here 2 minutes to share with the group. Again, I think for us to utilize the chat for this might be the easiest thing to do, but we can also do some hand raising in Zoom if folks want to kind of do a verbal share out. But I think putting it in the chat, you know, certainly gives folks access to, you know, everyone's ideas after the fact. So let's go ahead and get started with a couple minutes to brainstorm. All right, we have about 30 seconds left. If folks feel ready to start sharing some things in the chat, great. I see folks putting stuff in, so we'll go through some of those. Paying back during tax season, if a consumer drops down from drops their income, if they lose their income qualification. Political climate, yes. The challenge of there, you know, not being the penalty or the mandate anymore, that it feels too complicated to enroll, that there's minimal support versus looking for a plan that fits their needs, waste of time since they can't afford insurance plans not fitting needs, right? So these are a lot of assumptions that we believe people have about insurance. Okay, there are some abbreviations here that I'm not sure I know. EPO and HDHP, as well as limited network. I'm going to assume everybody knows what those mean. Even though I don't know what those mean. That you could get disqualified from other social service programs, that it's still too expensive, that doctors don't accept ACA plans, partisan bias towards Obamacare. Patients who believe plans are priced too high. Okay, and this Kimberly is saying she has a personal story that she is able to share with enrollees. Timing of open enrollment is too close to election time and that this will be a distraction. Digital divide, that is potentially a really big issue this year that I confess I maybe haven't given enough thought to. The perception that subpar insurance or that there's too many options with no clear explanation. Insurance literacy, yes, that is definitely a big challenge, especially for folks who have not been insured for a long time. Thank you. Exclusive provider organization and high deductible health plans. Thank you. I now realize HDHP. Yeah, so some of that is challenging news. Okay, so now let's flip the switch and take a couple minutes to think about what the positive things are related to Affordable Care Act plans, what the benefits are for people who we are going to help understand what's available to them and identify, plans that will be that will meet their healthcare needs and budgets. So let's take a couple minutes for that. Okay, we have just about another 45 seconds or so. I see folks are starting to share some ideas here. Melissa, I see your note. That would be fine. We'll get started in just a sec. Okay, go ahead and keep sharing your positives in the chat. We'll talk through these in a second. Melissa, let's go ahead and hear from our person with their hand raised.
All right, I've unmuted Claudia if you'd like to share out, and thank you for being our brave pioneer.
She's possibly on mute.
She does have to unmute herself.
Okay, while you're unmuting, we'll skim through some of these suggestions or ideas. Covering and preparing for the unexpected, that's a big one. We'll talk about that a little bit in some of the key messaging that I've put together for folks. That health coverage is affordable for those who are in the income range, who are eligible for financial help to pay for coverage. Personal testimonies, stories, whether they are folks who you know personally, folks that you know your organization has helped, and how the ACA plans or marketplace plans have made a difference for them in terms of the affordability of their health insurance and the services that they're able to access. This is a great one, an option to provide coverage for children of undocumented families who might not, whose parents, right, may not be eligible for employer-sponsored insurance. Plans that offer mobile apps. This is great. This is something I hadn't thought about. My husband's plan, which is what we use, has a mobile app, and we had to use it recently on a holiday to find open urgent care centers. And that is that's a really great tool. Healthcare for people who have or who develop underlying conditions, maintenance of care, financial assistance on a sliding scale is better than market rates of years past, the guaranteed benefits, and that you can maintain coverage regardless of how your job situation may change. Yes, these key messages will be shared, and Ruby, as we move through the next few slides, I have put together key messages for you, and you'll also have a handout that you'll be able to use. In these critical times, it's best to plan on having health insurance, absolutely. Most people are responding to panelists only. Okay, I see what's happening. So folks are not seeing these chats. So I'm glad I'm reading them for you.
It's just a reminder to make sure everybody's hitting panelists and all attendees so we can see everybody's answers.
Yeah, I'm noticing on my screen it's defaulting to all panelists as opposed to all panelists and attendees. Okay, so do we have Claudia on the line now? That sounds so funny, like
no, no, that's exactly how it is. No, she never did unmute, so
okay.
I think we're ready to move on.
Okay, so we're going to skip ahead from a next activity that I have, because I think I kind of have things in a little bit of an upside down order, but we're also we're going to run out of time in a few minutes. So I really want to make sure we take the time to cover key messages. So I have this activity called Defining the Audience. This is something that you can do on your own with your colleagues after the fact. This is called Defining Our Persona. And the persona, right, is the person that you're imagining you're talking to, right, that you're creating a message for. And so I identified the persona for us to be thinking about this year, right, who's a little bit different maybe than in past years. People who are newly uninsured yet familiar with health insurance. And so the way that you define a persona is you think about what their demographics are, right? What their family size might be, what some of their personality might be like, what kind of interests they have, what goals and challenges they have with getting insured, and what their values and fears are about their health and their insurance. So you kind of build a profile, right, of what this person or family might look like, and think about how you can message to them, what do we have to offer them, right? So let's move ahead to some key messages, and that will help you, I think about how you would talk to someone who is in this situation. So I have a lot of key messages here for us, and again, you'll get the presentation, you'll get the handout that I have after the fact. And that handout also has an activity that we're not going to have time to get to today, but lots of information about how to do that activity. So we have our key messages, right, that we have every year. The dates of enrollment, don't wait or you may miss your chance to sign up for a 2021 health insurance plan. If you already have health insurance, that we can help you shop around or shop again and find the best plan for you and your family. Again, with rates changing, you know, there may be more movement between plans this year, or people may, you know, find that they're just happy with what they have and they want to re-enroll. The key message that most Texans who enroll in an ACA plan get financial help to pay for insurance, and that we can help you make sure you get all the financial help that you qualify for. This is a very critical message to people who are new into the marketplace, because folks who have had employer insurance, right, are used to getting financial help paying for their insurance because their employer typically picks up a portion of the coverage, right, a portion of the premium. So that may be a way to think about talking to folks. This financial help that you might get, it's similar to, you know, how your employer has covered, you know, part of your costs in the past. Some more messaging that the ACA is still here for you, and we, your navigators and application counselors, we're still here to help you find the best plan for yourself and your family. This is really important in a year when people are not going to be able to really come in and meet with us personally, right? These are the different ways that we're still here to help you find the best plan, and whatever it is that your organization is doing. You know, key messages about the benefits that Marketplace Health Insurance offers that people are not going to be finding in a short-term plan, or, you know, even in some association health plans and some of the other products that are out there. And of course, there are more benefits than what I have listed here that you can think about that may be relevant to the population that you serve, to the individual client that you're serving. And then I've identified some new messages for 2021 that we have not had to reinforce in the past. Of course, a key one is about health and safety. What changes we're making to how we help you so we can protect everyone's health and safety. I think that this is, you know, kind of a paramount message for a lot of folks this year. And it's also really key for us to share with people how they can find us, right? If they can't come into our locations, where they can find us online, how they can call us and get help by phone if that's possible, which is something that can help bridge that digital divide question. People may not need to be in front of a computer themselves. How we're still offering that one-on-one personalized assistance, but we're doing it remotely, and whatever the tools are that we're using for that. These options for newly unemployed and uninsured. I really do think that reinforcing to folks who have chosen COBRA that there are options out there for them that may be more affordable, and that this is the only time of year they can choose them. If they don't choose, you know, an alternative to COBRA, COBRA will be the option they have until they get a new job, for example, or have some other circumstance that, you know, might create an SEP for them. And then finally, this, you know, you don't have to commit right now, especially with folks who are coming new into the marketplace. The idea that they do have some time to understand what their options are. But reinforcing, right, that we have our 6-week window, and that we are here to help them explore options and help them get the information that they need to make the choices that are best for them in terms of getting health insurance, protecting their health, protecting their families, and protecting themselves from the financial, challenges that may come without being insured. So this last section that I have here is this activity for how to kind of craft your message. Once you've thought of who your person is, who your audience is that you're trying to serve, what solutions you have to offer them in terms of their options. And so again, this is in the handout that we have for you, and I'm gonna stop there. I'm afraid I maybe went a couple minutes over my time.
We went a couple of minutes over time. That's fine. We will be sharing this information. I did have a question for our Zoom tech experts. There was a question in the chat box about whether or not these suggestions that people are offering are going to be available. I know that we're recording this, so they will be available. You'll hear them again. But can we see the chat stuff in the recording? I don't know that we can, but.
You can see what was placed to all attendees, but there may be a way where I have a record of the chat, so there may be a way where I can pull these all together, Sonia, and we might be able to share them in a different way. So if you do go back and watch recordings of any of these sessions, you'll be able to see the comments, but I don't believe you would be able to see the ones that were just sent to the panelists. So we'll work on that option.
All right, great. And I just want to remind folks again, if you have a question, do it on the Q&A. I don't have any questions for you, Lisa, queued up here. That was the only one I caught in the chat box. But I appreciate you sharing your information and expertise on how to target our messages. So important because we don't have those marketing dollars anymore. So it's really the onus falls on us to get that word out. So any way we can do that, we are going to do it. And one of those ways we can do that is through school outreach, which is kind of a nice segue into our next presenter. Melissa or Vanda, if you could please queue up the presentation, and we'll go ahead and turn it over to Gracie.
All right.
We're good to go, Gracie.
All right, wonderful. Thank you so much, Melissa. So I'm Graciela Camerena with the Children's Defense Fund, and thank you for joining us for our part of this session. We may go a little faster just to make sure that we end on time for everyone, but we're happy to be here. Next slide. To start, of course, I wanted to greet everyone. Gracias a todos por estar aquí. Again, this is just a friendly reminder, as we come together, either if it's 6 feet apart or 600 miles away, please know that we all have a responsibility to keep each other safe and healthy. As outreach staff, of course, we take this charge very seriously and take every precaution necessary when coming into close proximity with families that we serve and the community partners that we collaborate with. And this said, because as we are doing some of our work that we'll be explaining in this session, some people in the community, some of our other community members and partners, even our own family, tell us, are you sure you want to do this? There's so much, risk out there, but of course we're taking every precaution and just want to make sure that there's ways to go ahead and meet the needs of our community and still stay safe. So thank you. Next slide. For those of you that may not be familiar with CDF, the Children's Defense Fund Texas, again, our main mission is to ensure that every child have a healthy start, a head start, a fair start, a safe start, and a moral start to life, and a successful passage to adulthood with the help of caring families and communities. So again, we take this very seriously, and we're able to, provide the information that we support our families through the Children's Defense Fund. Next slide. Again, our goal is to improve child health coverage, and we have wonderful partners throughout the state through different partnerships and coalitions. And again, our main goal is to reduce the number of uninsured children in Texas. And this we do with the work that we do in the community and in school by improving enrollment and retention in programs like CHIP and Children's Medicaid. And of course, advocating, or as I sometimes say, fighting for policy changes to improve child health coverage. And again, we couldn't do this without the partnerships and collaboration of many people, like some of you that are joining us, some of our panelists. And so we're very grateful to everyone who was part of this to make sure that we are able to assist families and reduce that uninsured rate in Texas. Next slide. Again, our role as outreach across Texas in some of our programs, the Healthy Children, Healthy Communities project, again, helps to ensure a healthy start for Texas children, as we mentioned. That is our main goal, so that it can provide access to affordable and comprehensive health and mental health coverage for children. Again, we meet children and families where they are, and we work with partners like you that families already trust. So again, this is a village that comes together to make sure that families have information that they need to either enroll or renew healthcare coverage and understand what's available to them. Of course, this collaboration is drawn across various areas, mainly in schools. We also collaborate with different businesses, churches, libraries, and with various community partners that also have a goal in ensuring and keeping children healthy. Next slide. So again, partnering with schools, this is our focus for this session. So partnering with schools has been central to our strategic approach. And of course, dozens of Texas school districts have taken part in participating and identifying uninsured children to different methods. The one way that Children's Defense Fund has worked with for many years and has shared these strategies was adding a health insurance question to school enrollment forms. So as children were enrolling in back to school, either new to the district or just coming back to their districts, there was that one question that was asked, usually once they went through the different sections of the enrollment, once they got to either the nurses table or section, they would ask that question, does your child have health insurance? So by identifying these children whose parents said no, or don't know, or they had it before, this was an opportunity to provide information and to follow up with that family with access, either a direct referral or direct assistance to apply for services and benefits like CHIP and Children's Medicaid. And of course, for those families who may not meet the criteria to qualify for these programs like CHIP or Children's Medicaid, we shared information about access to healthcare.gov and enrollment in a health plan like that, or also the wonderful partners and friends at the federally qualified health centers, so that families can have a primary medical home at one of these clinics. So we were able to share and continue to share these referrals to families who may not qualify for health insurance through the marketplace or through CHIP or Children's Medicaid, but they still have access to a medical home with these clinics. Next slide. Well, we're talking about the question about does your child have health insurance? Again, there's this toolkit that was created with Children's Defense Fund and the American Association of School Superintendents, or AASA. Again, very important collaboration that we were able to work with dozens of schools across Texas and other states to be able to bring this toolkit and make it available for those who may want to start up the work with school districts that may have not done that before. And again, the goal of this toolkit is to provide school and community leaders and parents, parent and child advocates with a framework to build the capacity and support in connecting children to health insurance by providing the practical steps. So for those of you who have not visited this toolkit online, it's called insureallchildren.org. You can find that framework and those steps to be able to start that conversation. And also it provides the schools and the school systems also with steps for them to take and to participate in order to be able to collaborate with everyone. And again, realizing that the critical role of schools in the lives of children and families is very important. And of course, the role of the superintendent leadership for any school policy or program or practice, it's also important. Sometimes we're asked, well, where do we start? Where do we start? We want to work with these school districts, but they don't let us in, or we don't know who to talk to. Of course, it's always good to talk or identify someone at the top level, like the school superintendent, but sometimes it takes the parental engagement department to be able to get you through that. So build those relationships with these departments. Let them know, what you do, how you can do. And this toolkit itself can help you with those steps. Next slide. Talking about schools and how important that is to communicate. Schools are in a powerful position to bring this information about affordable healthcare to children. The benefit for everyone involved, of course, is crucial. And as we can see some of those results, healthy children get higher grades and have better attendance, even if it's virtual attendance. If your child is feeling well, they're going to show up on camera and participate with their schoolwork and activities and do well. Also, it helps parents stay involved and participate in their child's education. And of course, school districts meet and almost always exceed goals and expectations and policies that they have to strive for when there is this collaboration and work together with the parents and making sure that the children are healthy and participating and coming to class or attending their virtual sessions. And of course, overall, we want to see the outcome where these healthy children graduate high school and then enroll into college for a better future as well. Next slide. So here we are. Here comes COVID-19. And of course, for many of us, adapting to that change and realizing the new reality just hit us. There was fear and disbelief. We went through times of shortages from just items that we needed every day, like water or toilet paper. And then of course, death. So this is something that has really been hitting everyone hard. Communities like in the Rio Grande Valley and of course across the country. But I know that Hidalgo and Cameron County in the recent months have been the hot spots for COVID cases, and we're still struggling with that. We're hoping to see a decline in that, but still it doesn't take away from this fear that has already been embedded into our communities. So again, we're asking ourselves, how do we keep doing what we do, with this new environment that we have, and how do we stay connected? The school year started, back to school, we didn't have those big events like we usually do and participate with our partners, many of you who are on this conference, but we still have to move forward. And again, we are asking ourselves, how do we provide updates and information? Next slide. So again, we have to think outside of the box. Outreach as we know it has changed for now. We're hoping that we will, get through this and things will pass, and we'll be able to do the activities and reach the communities that we need to serve. And we've been so grateful to serve in the past. Again, working from home is difficult for many of us. And of course, the remote learning for children has also been something that they've had to learn to do. Kids are wonderful with computers and technology, but again, just this whole learning and atmosphere for the teachers and the administrators, making sure everything's in place. I can't imagine what our teachers are going through to be able to, set up this whole online virtual class and meet the needs of the children. And then of course, the other departments within the school district, the family and parental and family engagement department, the nurses, the social workers who are usually, able to get the referrals and see what's going on and assist families. So they may feel a little bit disconnected, but there's ways to, keep going and provide that support. So again, thinking outside the box of what we can do to continue to work with school districts is very important. My coworkers, Mary and Tina, are gonna let you know some of the things that we've strategized and looked into. Some may be new, some may not. But for us, we're gonna show you, or at least share with you, some of those best practices that have worked for us. And we're happy to continue to do some of these. I'll allow Mary and Tina to share those. But if you have questions about how to reach out to the school districts, what is it that, the steps that need to be taken, please feel free to reach out to us either through the chat or after the session. Our information will be available as well. You can reach out to the Children's Defense Fund and we can share at least our experiences. Again, the parental and the family engagement departments have been crucial to just keeping us together and providing these links to the families that need the assistance. Not every family needs them, but those that do, we want to let them know that we're here and we're going to continue to provide that support.
So Gracie, we do have a really quick question for you. Sure. Where are CDF services available? Kimberly is sending this message. I am from Central Texas and have never heard of your organization. I would like to know.
Okay. Well, Texas, with CDF Texas, we have offices in Austin and in Houston. We also have offices in East Texas, which is outreach, and then the Rio Grande Valley. So I'm in the Rio Grande Valley. I'm in Weslaco, Texas. We have our office in McAllen. Mary is in McAllen. Tina is in the Far San Juan area. We do service Cameron, Willacy, and Hidalgo counties in East Texas. There's also various counties that are covered in East Texas. I wish I could name them off. I know there's Gregg County, and then they're out in Tyler and a few other counties in that area. Of course, we have our Houston main office. There's not an outreach team in the Houston office or in Austin. Austin, we have a policy office. But again, our work is throughout Texas. And again, the main outreach offices are in the Rio Grande Valley and in East Texas around the Tyler area. So again, these are the main places for outreach, but our overall CDF is a statewide, actually we're a national organization, but in Texas, statewide, providing information for outreach, development, policy, and we do our best to be able to provide the steps to build your programs where you are if you don't have one in those areas.
Thank you. That's all we have in the queue.
Okay, thank you. And please, if you would like to know more about CDF Texas, please visit us. There is the website at the end of the session, cdftexas.org, to let you know where we are located in the different programs. And then of course, cdf.org as our national organization. Then I'll go ahead and leave this next slide to Mary so she can do her part. Thank you so much.
Thank you, Gracie. There we go. Thank you, Gracie. In the next couple of slides, I'll speak a little bit about what CDF RGV team did and how we assisted our community during COVID-19. Yeah. We knew that we had to identify a way to reach our community through social media. We were shelter in place. There was no other way to reach the community in need. We had to think outside the box. We understood the fear, the anxiety, the outcry of our community, because we were feeling it too. We were just as scared as they were, and we needed to strategize to come out with a plan to serve, because that's what we do. And we got together, we strategized, and we knew that we needed to either put public announcement videos, we had to come up with flyers, we needed to be on television, on radio, we needed to post information of what was going on, because our community needed us, and the phone calls started coming in every day. It just got greater and greater. The need was so real, and we were living it with them. Next slide, please. And when we started to receive these phone calls, you know, the need was SNAP. Like Gracie said, food assistance, grocery stores were running out of supplies, and our community was scared. They were calling us about healthcare. Their children's Medicaid was about to expire. What were they going to do? They were getting laid off. They were being furloughed. You know, these were all fears of our community, and we understood them. We related to them because we were thinking the same thing. Our county services was assisting with different funds for housing, for rent, utilities, and we wanted to bring those services out to our community, the community that we serve. But also they were reaching out to us with fear, anxiety, scared. They didn't know what to do. And we related because we were there too. There was times that we called each other and said, I'm scared, you know, I'm having anxiety. What are we going to do? But we jumped into action. Next slide, please. And we knew exactly what we needed to do. We needed to find a platform that was going to be able to reach our families in their home, because now we couldn't meet them face to face. We were sheltered in place. We couldn't go to the school. The schools were closed. The churches were closed. There was nowhere else, no community centers to go reach them. So we started thinking, what are we going to do? We're going to reach them through social media, because everyone was stuck on social media. We were always on looking at different pages, organizations. So we knew that our community was on Facebook. They were using the WhatsApp application. They were doing Messenger, Snapchat, Twitter. We wanted to get on TV, like I said, earn media. Next slide, please. But we needed to identify and target our audience. What was our population using? What were they familiarized with? So we knew we narrowed down to the Facebook and WhatsApp applications. So once we figured that out, we knew that our community here in the Rio Grande Valley was mainly Spanish speaking. We asked, are they literate? Can they read and write English? What do they know? Spanish? Are they able to use their computer? Next slide. We had narrowed down, and so we knew that we needed to act, and we needed to put a Facebook CDF RGV with resources, information that was true, that had facts, that we were able to spread the message just like we were next to them. And we created more about April 9th, a CDF RGV, a Facebook page, and we're going to show a little video here of some examples of what we've done to stay in contact with our community and still inform them with information. And this first slide is a census. This was just recently, I believe it was Sunday. I was watching the 9 o'clock news, and they had a reminder that we had 10 more days to do our census survey. So I knew that that was an important message. I had been so busy and I had missed that. So here's.
Amigos y gracias por conectarse
Go ahead.
aquí a su página Children's Defense Fund Texas, Rio Grande Valley. Miren, esta tarde venimos para darle un recordatorio que ya nada más nos quedan 10 días para poder hacer el cuestionario o completar el censo. Ya el 30 de septiembre es el último día que usted va a poder registrarse o hacer el cuestionario que cayó por correo. Si usted dice, pues perdí la carta, no sé a qué número hablar, déjeme darle el teléfono para que usted pueda hablar hoy, este día, antes de que pase este día, al teléfono 1-844-330-2020 es el número del censo. Otra vez es el 1-844-330-2020 para que usted pueda hablar. No se le pase de hablar, tiene hasta el 30 de septiembre para que usted se registre en el censo del año 2020. Eso es nada más una vez cada 10 años. Acuérdese, unidos contamos. Gracias, los invita Children's Defense Fund para que haga su censo 2020. Gracias.
Thank you. And then on this one was just a quick reminder.
Muy buenas tardes, amigos, y gracias por conectarse aquí a su página Children's Defense Fund Texas, Rio Grande Valley. Miren, esta tarde queremos hablar unos poquitos segundos tocante el programa de SNAP y Medicaid para niños. En este mes de septiembre, ustedes van a recibir el paquete o la carta de renovación para estos dos beneficios. Si usted es recipiente o conoce a alguien que ya está inscrito en el programa del SNAP o de Medicaid para niños, recuérdele o avísele que ya van a empezar a recibir cartas de renovación para estos dos beneficios. Si ustedes se acuerdan, en el verano, ustedes recibieron cartas diciendo que es autorrenovación. Ahora ya no, ya van a empezar a renovar. Entonces, si usted recibe una carta y necesita asistencia para poder aplicar por estos beneficios, para renovar estos beneficios, contáctese con nosotros aquí a la organización Children's Defense Fund con una de sus representantes que son Gracie Camerena, Tina Guel y su servidora Mary Carreon. Estamos aquí para asistirles con estas aplicaciones de estos programas. Otra vez al teléfono 956-563-9913. Le deseamos un bonito día de labor, de trabajador, como decimos en nuestro país. Hoy, el día de Labor Day, usted sígale pasando bonito con su familia, disfrute su hogar, su familia, sus familiares. Acuérdese que estamos en contacto. Su salud es importante para nosotros. Dios los bendiga y nos vemos muy pronto. Gracias. Adiós.
Thank you. Thank you. So when we started doing videos like this, we wanted to make sure that we were a familiar face in our community, that we related to them, that our message was clear, that our families were able to understand, because sometimes we receive calls that, you know, they're reading and they don't really understand what they're reading. So we wanted to make it easy, direct. We wanted to make sure they understood. We wanted to make sure that they knew that we were their friend, that they could trust us, that we knew what we were speaking about, that we were just not posting rumors, that we cared, had compassion. The next slide, please. Thank you. That we were true to who we were, that we are here to serve our community, and that they were real people. We knew our community. We see them, you know, every so often out in the schools when we have our pláticas. in our community, in our church, in our food pantries. And we were their friend, now almost family, because this was the only way we were communicating with them. And what we want to say, or what I want to say today, is to always remember that these are families that you're affecting lives. They're reaching out to you because they need the services. This could be your family, your friend, your co-workers. We're all in need right now. And please make sure that when you are assisting them, that you do it 100%, and that you have the passion and the caring, because they will know that although they may be literate or they may not speak our language, they know, they could see it, they could feel it. And I always say that if you transmit that passion and that caring through your videos, family members will share your phone number and your contact with others. And that's how we get our referrals, usually through word of mouth, because our families know that we're there to help them, not only at time of need, but always. You know, they could count on us. Next page, please. We stay in contact with our community partners. They're also part of our family. And again, I seen that some are on with us today. And we text each other, how are you? You know, are you doing okay? And they do that to us. And we always want to make sure that we share their message through our page. We invite them to come on our page and present their services. I've been a guest speaker on some of their organizations and their websites. We stay constantly in contact with our colleagues. That line of communication with our community partner family is always there, and we're always informed. We stay in contact with our city, our federal, our state pages. That's so important, because our families, or the families that we serve in the Rio Grande Valley, they don't know how to navigate the internet. They sometimes don't even open letters when they receive them. They reach out to us. Next page, please. So we always want to stay on top of the game and refamiliarize ourselves with other agencies. We have conversations with our families. We listen to their need that's going on right now. You know, where can I go get a COVID test? I just had a loss in my family. What do? I have no funds. Through the pandemic, our area received a lot of funds through the CARES Act. So I was constantly, every day, spending hours and hours on the internet, you know, calling and reading and trying to educate myself to pass the word on to our community. And when I didn't have the answers, I was reaching out to my community partners, because there's going to be times that, you know, we could only do so much, or we don't have the funds, or I can't do it. So my community partners there, and we refer out to them. And once we do that, we just don't let go of that family. We're going to follow up. We're going to find out what happened. Did you get the service? Did that person return your phone call? How did it go? And if they didn't, then we will follow up, and we will call that community partner. Hey, were you able to help my family? You know, what can we do together? If you don't have the services, what can we do? And I start making phone calls. I'll call wherever I have to, just to get that family the service that they need. Next, please. And now I will pass it over to Tina, for she could speak about what we're doing in our community and schools. Thank you.
Okay, thank you, Mary. Yes, I'm gonna be talking about a little bit of how we have been reaching to schools and the community together. Mary was saying everything that we did in Facebook. She was giving showing us the videos that we have been done, but also we have been working in the field. As you see in these pictures, right here on this left side, right here in this picture, I was in one of the school districts I was distributing the flyers that we have, providing information about children's health insurance, Medicaid, CHIP, any questions that they have for renewals, while the parents were picking up the lunch meals. And on the other side, we are working a lot on churches. And also in these pictures, you can see that we're giving out flyers and information to people that is waiting for the food distribution in the Alamo Community Church, which is one of the partners that we have been working throughout this pandemic time. And we're collaborating with a lot of partners in the community, giving all the resources that we have available. Next slide. In the past, we used to be creating more health fairs when small community churches, recruiting and bringing in a scope of community service and organizations, including different services like vision screenings, diabetes testing, and other resources. But now, when this pandemic time, next slide. We are continue working in the field, taking different precautions like you see in these pictures. Right here on my left side, I have Mary working, also giving flyers to the community who is receiving food distribution from one of the churches. And right here, we're working on some of the partners that we have from Census. And also we have been seeing members or clients, families, helping them in the application process. And one of the pictures here that you see, I'm working in application for PVT. We had a lot of need. A lot of the families didn't know how to apply, what to do, what was the process. Some of them have already SNAP, and they may have 4 kids and 2 of them have Social Security number, and they will receive the benefit through the SNAP benefit. But what about the other 2 that don't receive the benefits? We will have to do the applications. And some of them, they didn't know how to start. So we had an event in one of the churches, and we were helping them to do the applications and to follow up to all the process that they need to get the benefit. Next slide. Okay. Right here, we have a video that we post on the Facebook page. And it's also, we were talking about the PVT, how it's gonna be the process, walking the families through all the process so they know what to do, what to expect. I don't know if we can see the video just for a little bit.
I don't know if we have time anymore. I'm so sorry. We've already gone over the time for our session. But I know that we're going to have these slides available so folks can see these videos that you've embedded in your presentation. I just want to just take a couple of moments really quickly. There was a couple of questions about your resources. First, if there's digital flyers that they can share, if you have resources available in Spanish, just really quickly, if you could answer those couple of questions. And then I think at the same time, Melissa, if you could just put the last poll up while Gracie or one of her staff is answering those questions, and we can make sure that we get that done as well.
Yes, yeah, I don't know, Gracie, you wanna answer those questions? I will pass it out to Gracie then.
Yeah, Gracie's typing the answer, and we do have the poll going, so please take a second. Oh, sorry, it is now going, so please take a second to answer that. And then I just want to acknowledge that Claudia Garcia had asked a question about renewals. Tune back in this afternoon. I am going to go on a deep dive into the renewal process and what's happening right now during the public health emergency. So if you're unable to attend that afternoon session, the recording will be made available to everyone who's registered. So so we'll still get a recording, but we are going to cover all of your renewal questions in detail this afternoon. We have a whole hour and a half dedicated just to that.
So Gracie, I don't know if you just want to tell people, because we're going to have to cut it here in a little bit. You just want to say, are these, if you have those resources on your website, if they can go to your website.
Yes, and we'll share them with you, Sonia, so they can be available also for the session after you send information after the session as well. We greatly appreciate people's interest. We appreciate everyone. Again, just because we're in this situation, the pandemic, doesn't mean we can't still reach out to our families, especially now that school has started. We're probably going to see some changes or some in-person, school activities and some still virtual. But we can definitely continue to share our best practices and make sure we reach those families that need that extra assistance that we as Children's Defense Fund and you as community partners can provide. So thank you everyone for your time, for your interest in joining us. Nos extrañamos, we miss you, and we're hoping to see you very soon.
Great, and thanks to all the panel. Thank you for being with us today. Just a reminder, please join us for our last session later this afternoon, where Melissa McChesney will be leading the deep dive into improving renewals for CHIP and Medicaid and making sure that our families are covered during all this confusion with the renewals process right now. So please tune in later. Thanks again for everyone. I'm going to go ahead and end this now. If you can join us then later. We thank everybody again and see you later on this afternoon.